As we pull the drones back home, it is one thing to see most of these activities going to full gear. How much of political will, how much of encouragement would you say you received from the governor to get most of these things stretched out?
Without the political will, health insurance cannot work in social insurance. State-run social insurance cannot work. And so that we have gotten this so far means that there have been a strong political will. Political will is not something you can grab and see, but you see the effect. That regularly we get people enrolled in, we got funds to pay for services rendered, we have funds to run the system here, mean that fund is being released to us. And it's only a political willed system that releases funds to an agency. And so that is there. And I wasn't surprised, and I'm not surprised, because the present governor, Right Honorable Sheriff Oborevori, was the speaker, was a member of House of Assembly when this law was passed. And he has been defending and supporting the system even before he became a governor. When he was a speaker, he did a lot to support us. So I wasn't surprised that when he took over, the goodwill of the former governor, Senator Ifeanyi Okowa, continued. And I will tell you one of the signs of goodwill, political goodwill and force. Reappointing my honorable self from the chairman to go and come and sustain the system is a sign that you want the system to survive. Instead of bringing a brand new person, say, no, Dr. Akpoveta, come and stabilize the place, come and sustain the place. And so that is very important. It's a sign that he's determined to ensure that this place works. And since I came in, I've been very supportive financially, politically, advice-wise. And so I must thank His Excellency the Governor for his effort to ensure that Deltans, you know, the more agenda is very clear. He wants to do more. Symbolically represented, want to do more for Deltans. And what is more than good health for people? So Sheriff cares. He cares for Deltans. He wants to ensure that Deltans get good health and quality health care in the system. So there is a lot of political goodwill from the government.
It is often interesting when we hear most of these things in the news. Is it possible you add figures to how much you've inducted Deltans into the program?
Yeah, thank you for this question. Delta is number one in all the scores of health insurance in the Federation. We are the first to start statewide social health insurance. In other terms of achievement of the scheme, we are number one. But most importantly, the key factor in health insurance is number enrolled. By today, we have enrolled well over 2.2 million Deltans into this scheme. And more importantly, about 1.7 million of them are vulnerable people. In fact, it's because of the vulnerable people, really, you create social health insurance. And we have gotten about 1.7 million of them. But in total, we're about more than 2.2 million Deltas into this scheme. Number one, any other state is below 1 million as of today. You can prove me wrong, but I know that figure because every month we submit our release numbers to the National Health Insurance Authority. So we know what we have in every state. So we've done very well. Deltans have accepted, and that's about well over 30% of Deltan population. So we are going to 80%, and that will become universal. And it will be self-sustaining by then. So we've done very well, and we are seeing, in fact, the numbers are coming faster than before because people have now accepted the scheme, they are enjoying it, they appreciate it, and as such, people are voluntarily registering, people are voluntarily adopting people and paying for them to receive care. And with that, again, we did something that is very unique. It's only in Delta we have what we call the access to finance. The access to finance was a project between Bank of Industry, Farmers Foundation, Delta State Health Insurance Commission, and Credit Fund. where we pull funds together, loan it to private providers who had a PPP, public-private partnership with us, and went into the rural, hard-to-reach areas, in the riverine areas, and opened up moribund health facilities built by Chevron, philanthropists that were not functioning. We took them up. Out of 25, we have been able to activate 18 of them in areas where you need to take a flying boat for 4 hours before you can get there, where they have never received care in their life. We took healthcare to them. And so it's a world acclaimed initiative that even recognized by United Nations, by WHO. And it's being adopted now as a model for the Niger Delta 9 states. And so very soon you're going to hear about access to finance initiated by Delta State, now becoming a national, regional, and a national condition initiative. And we are proud. We win awards in all these issues. Well over 4 awards from different national and international organizations for performing well. And I think the Delta is proud of that, and the country is proud of Delta State. Thank you.
Yes, sir. It is said that what gets measured gets done. Are there infrastructures in place by the Commission to ensure that these UN release get the needed care they demand from those, and ensuring that people do not just...
We've accredited about 522 health facilities. Recently increased about 540 health facilities across the state. We don't just take any health facility. We go there, assess it, and accredit it. Where I will say that service provision still has some limitations. And this is because a lot of health resource for health, human resource for health, is depleting in Nigeria. A lot of them have traveled abroad for general practice, so we have constraint of number of the ratio of health workers to population is very high, and that is causing some constraint in the system. But I'm happy that the governor, the minister, the commissioner for health, even the national level, if you read the paper only yesterday, the National Assembly have decided that they have to do something about reducing number of health workers in Nigeria. And the state is doing something, it's employing every day, there's employment of health workers. We held a meeting even just only yesterday to ensure that we look at the challenges in the sector, in the service side. You know, we have the demand side with the health insurance agency, the service side with the hospitals and health centers. We are working on that seriously, because without that, the system will have some more challenges, and want to reduce that challenges, and government is aware of that. We are also supporting that to ensure that we have a seamless attendance to our release in the system.
What would you advise to Deltans who are targeted or who might have understood the good news and the duty inherent what the state is doing with the Health Commission?
I think for those who know, first they should go and tell those who have not heard about it. I've come to realize that no matter how loud you scream, some people won't hear you. But a lot of Deltans are aware of this scheme. I want to appeal to them to talk to their neighbors, their friends, their families, that there's something good happening. And it's so cheap because it's subsidized by the government. And that's the Delta State Control Health Insurance Commission. Let all Deltans ensure that they register into this scheme. It's very, very important for them, because health is wealth. You can't do without health. You can have all the money in this world, and if you don't have good health, you can't enjoy it. And government has put in place a system and to give you good health with minimal cost. In fact, a lot of it free. So no woman in Delta, pregnant, should go to any hospital without going to the hospital where you can receive social health insurance, to get registered and take care of it. Every child should get enrolled into this scheme so that we can protect them from sudden illness that can become fatal to them. In summary, all Deltans should voluntarily come and register into the social health insurance scheme of Delta State. as supported and promoted by the more agenda of Sheriff Oborevori. Thank you.
Thank you so much, sir, for giving us this time. We look forward to having more of these conversations with us time permits.
Thank you too. I appreciate your coming to talk to us.
For more on this program, please subscribe to Nol 24 TV, Nigerian Online 24.